everyone, and thank you, Dr. Kerwin, for your comments this morning. And I'm so glad that we have everyone join together at Pennington Biomedical Research Center. You know, throughout this year, people in our community, our country, and across the globe have seen the importance of public health due to the coronavirus pandemic. We've seen now how health is, without a doubt, an underlying factor in our daily lives. Our health affects our well-being, our opportunities, our development, and certainly our prosperity. Many of us, especially many of you all who are with us today, recognize that health is a complex issue. It is influenced by genetics, individual behaviors, influenced by socioeconomics, access and quality of health care, environmental factors such as air and water quality, housing and transportation. These are complex challenges, so it is incumbent upon us to apply innovative and holistic solutions. Today, we are here to discuss the progress that we have made in the public health of our community and how we intend to continue the progress. In 2018, the members of my Healthy City Initiative, which include all 5 area hospitals and over 100 nonprofits, businesses, schools, and governmental institutions, joined together to release the nation's only joint community health needs assessment and implementation plan. This plan encourages collaboration across sectors such as community development, health, housing, and employment, because we know that all of these sectors influence our quality of life. At that time, we identified the 4 most significant health needs facing our residents here in East Baton Rouge Parish. The first being healthy living, which includes eating well and practicing healthy habits such as exercise and preventing chronic disease. Then, behavioral health, sexually transmitted infections and HIV. And lastly, access to care. By identifying these needs and working with our stakeholders, we have made significant progress within Baton Rouge's healthcare landscape. Now, of course, I could spend hours speaking to all of you all about the strides we have made thus far. But in the spirit of collaboration that we have embodied over the last few years, I would like all of you to hear from some of our partners who have made this possible. With that being said, I will now hand it over to Coletta Barrett, Chair of the Board of the Mayor's Healthy City Initiative. Coletta?
Thank you, Mayor Broom. As Dr. Kerwin said in his opening statements, the Community Health Needs Assessment is considered the son of the Affordable Care Act. It is probably one of the more important aspects that have stood the test of time since 2010. For those of you who are not aware, that Affordable Care Act required not-for-profit hospitals in communities to create every 3 years a community health needs assessment and to work on prioritized health needs. Now, what Baton Rouge did in 2012, the first time that they worked together, was a collaborative community health needs assessment where we all worked together, did the research, shared the information, and each individual hospital did their own community health needs assessment. In 2015, 3 years later, we approached the Catholic Health Association, who is probably one of the leads in helping the IRS craft the regulations about the community health needs assessments. And we were encouraged to do a joint community health needs assessment if all of the boards of the individual hospitals voted on the same market, then we could do a joint community health needs assessment. It was not until 2016 that those regulations came out from the IRS. But your community took a leap of faith and said, we know this is the right thing to do, and we did it. We were recognized in 2015 by the American Hospital Association with a NOVA Award. All of the 5 hospital CEOs went out to California and innovative, as the mayor says, and collaborative nature for addressing public health. As institutions, we may compete on market share, but when it comes to public health, we collaborate. And that's what they noticed and gave us recognition and kudos for. Fast forward to 2018 with Jared Heimowitz, the director of the Mayor's Healthy City Initiative's leadership. That joint community health needs assessment produced a joint implementation plan. Hospitals all agreed to follow a standardized, community-wide implementation plan. We were recognized nationally as the only community to do both a joint CHNA and a joint implementation plan. There are many communities across the United States that now do joint community health needs assessment because there is power in working together. But none of them have agreed on the implementation strategies. That takes courage. That takes trust. And that's what's been built by the institutions and the community since we started this work long before 2010. So as we move forward with creating the 2021 Community Health Needs Assessment, it's time for us to stop and look back at what has been done so that we can see our way clearly as to how we move forward. So first I would like to call upon Dr. Barbara Griffith, who is the CEO at Women's Hospital, to share some of the major milestones and improvements of our colleagues at Women's.
Good morning, everyone.
Good morning.
Babies born to mothers addicted to opioids can be premature, they can be born with low birth weight, or they can even have severe withdrawal symptoms after birth. So in 2018, we launched the GRACE program to support women suffering from opioid addiction in pregnancy. Women enrolled in GRACE have the support of a social worker and a nurse who support them throughout that pregnancy. And our staff coordinate their care to ensure they go to prenatal visits and have access to many other support services. It is that access which helps them to stop using opioids. In 2 years, more than 100 pregnant women have been enrolled, and most full-term pregnancies. And those infants have not needed ICU care. The stories that we hear from these women are so impactful. Some of them will tell you that GRACE saved my life. The support and the access to great care is what saved their life. And this is what needs to be done for all of our women who are at risk. Going forward, the GRACE program, initially funded by United Healthcare, will transition to the MOMS grant, and that was a grant that was recently awarded to our state by the Center for Medicare and Medicaid Services. We will expand this work, and we'll carry it further in time into the post-delivery period to ensure the best outcomes for moms and their babies. Ongoing work at Women's will continue to move us forward in improving maternal and infant health, as well as better understanding the social determinants that must be addressed. And so as we look forward into the future, we are so excited that maternal and infant health has been identified as a top priority for 2021. This is so important because moms in Baton Rouge are not all getting the prenatal care that they need. Nearly a third of women are not receiving adequate prenatal care. By addressing racial disparities that impact Baton Rouge women, we will reduce premature births and will reduce our mortality rates for both women and infants. By addressing access to care, we can build healthy families, and through working together, we will find community-based solutions that lead to a healthier community. Thank you.
Thank you, Dr. Griffith. Thank you very much. Next, I'd like to invite our colleagues from
all, I'd like to thank Mayor Broom for having me here today. Oshner Baton Rouge is deeply committed to improving the health of the communities we serve. We are proud to work with you and other partner organizations to achieve a healthy Baton Rouge. We know this is a big lift, and COVID-19 has shown us there's a lot of work to do to address the health disparities and to improve the health of our communities. But we want to change that at Oshner. We envision a healthier state, and that includes a healthier Baton Rouge. As part of this vision, we are continuing our community-focused strategy of providing care when and where our patients need it, and providing resources to care for the whole person. In July, Oshner Baton Rouge joined Mayor Broom to announce our commitment to help revitalize the new medical complex in Howell Place. This health center in North Baton Rouge is part of Oshner's newly announced 10-year commitment to creating a healthier state for all residents. The 5 years strategy includes a $100 million investment that will focus on programs that eliminate barriers to health care and bring resources into underserved and rural areas. As part of the statewide strategy, Oshner is opening 15 community health centers across Louisiana and in the next 3 years, including Howell Place and a second location in Baton Rouge. Each location will be opened in an area that has been traditionally underserved. These centers will expand access to primary and preventative care as well as behavioral health. We're grateful for the support of Drew and Brittany Breeze and the Breeze Dream Foundation for a gift of $5 million to support this initiative. These health centers are examples of some of the latest investments Oshner is making in Greater Baton Rouge. As you know, we opened Oshner Medical Complex, the Grove, just over a year ago. The Grove represents a $116 million investment, Oshner's largest capital project to date, to deliver innovative and convenient care to the people of Greater Baton Rouge. Our investments are focused on meeting people where they are, improving the health of the whole person, and partnering with like-minded organizations to tackle some of the biggest healthcare challenges facing our communities. We have been honored to work alongside Mayor Broom to address our community's most critical health needs, and those were identified in the Healthy EBR Community Health Needs Assessment. This includes the implementation of opt-out HIV testing in several area hospitals, including Oshner Baton Rouge. We know testing is a vital tool to combat HIV and AIDS. People infected with HIV, particularly in its early stages, may be unaware and therefore more likely to spread the disease. The need for testing in our community is clear. Testing reveals an HIV diagnosis in everyday people who had no idea they were positive. Under the opt-out testing initiative, patients seeking emergency care are automatically tested for HIV as part of routine blood draws, unless they opt out. Once a patient learns they are HIV positive, Oshner's Patient Navigator helps connect that individual to the necessary treatment regimen. The goal and often the result is to bring the disease to undetectable, non-transmittable levels. The program at Oshner has earned praise from the CDC as something that can and should be replicated not only across the state, but across the country. In closing, I'd like to again thank Mayor Broom for the opportunity to speak today about what Oshner Baton Rouge is doing to create a healthier region and state. We can accomplish amazing things through collaboration, and Oshner is honored to support the health of Greater Baton Rouge and beyond. Thank you.
Thank you, Eric. Thank you very, very much. And next, I'd like to invite up Mr. Scott Lester, CEO of Our Lady of the Lake, to share some of the lake's accomplishments.
Thank you, Colette, and again, thank you, Mayor, for hosting this morning. I'm going to do a little bit of a pivot and making sure that people really recognize how important this work really is and how unique this relationship really is. As Colette indicated, we have not found another community in the United States that has actually figured out how do we implement, take the resources of our combined organizations and do really what's important into the community. And we're so privileged to have the relationships among all of us in the room, and there's many other partners that stand next to us, really trying to identify what's next. You know, Eric talked about the work we're doing in the HIV and opt-out testing. When we communicated with the CDC and said, wait, we got one of the highest incidents of HIV in the country, what do we do? And they said, here's the recipe we think may work. It's no different than us in COVID, of masking, social distancing. It's the same type of philosophy. And then us as a community to say, we got to do something. We got to do something different for the benefit of all of us across this great parish that we live in. And we decided to do it. Well, we finally started to see the results and actually being able to move up the rankings of having less incidence of HIV. And then we said, well, let's double down and let's look at hepatitis C. Hepatitis C is another big issue we have in our community. So let's not just do the HIV test, let's also do the Hep C test. And then working with the Louisiana Department of Health and through the governor's office, and at that point, Secretary Gee, let's provide free medication for those who have hepatitis C. And some of that work gets generated because of this collaboration we have in Baton Rouge. It's an envy in New Orleans, it's an envy in Lafayette, it's an envy in other parishes across the state to have them see what we do each and every day. Earlier this week, I had a presentation about the work we're doing in food and nutrition. And predominantly those that are low-wage earners or those who can't afford normal groceries. And the work we're doing to make sure, number one, they get access, but more importantly, it's about education. Education of the why. Why is it important to have good food habits? Why is it important to make sure your kids get meals on 3 times a day? What types of meals should they be receiving? And the work we're starting to see there is we're changing behavior. And that change in behavior results in improvement in the health and well-being of our community. The work we're doing about education, let's not go to all the ERs. We have an abundance of emergency rooms that maybe, as we've seen post-COVID, is that we've seen a huge reduction, about 20% of ER volume, because maybe people didn't use the ERs in appropriate fashion. And so we have things such as urgent cares. We have how do you identify to get a primary care, for making sure we got the right level of care at the right location at the right time. And again, this education, this momentum. I'm so excited about 2021 and the continuation of the Community Health Needs Assessment. And you will hopefully continue to see us be very collaboratively working together to really improve the overall health status of the East Baton Rouge Parish, which will trickle into other parishes, because once we do things, people kind of look at us and then they'll try to do it as well. So again, Dr. Kerwin, thank you for hosting us here today, and the Mayor for your unwavering commitment looking after all the residents within this parish. Thank you.
Next, I'd like to call our partners at Baton Rouge General, Edgardo Tenrero. Please share with our audience here today some of the accomplishments of our friends at the General.
Thank you. 3 years ago when we put together the last community health needs assessment, we really began to focus on an area that was buzzword at the time, but it's really become a core component of what we do at the General, and that is not only to address health issues, but to address the social determinants of health that can make it a lot more difficult for patients and people to become as healthy as it possibly can. Now, the reality is that it's much harder to be healthy if you don't have access to nutritious food, if you don't have access to transportation, if you don't have access to a safe neighborhood in which to walk and exercise, and if you don't have a job. And so one of the things that we have done at the General, recognizing that it is difficult for a hospital system to directly impact the social determinants of health, is to develop an innovation grant program that has allowed us to partner with other members of the community who actually do specialize in addressing the social determinants of health. And just to give you one small example, we partner with Front Yard Bikes, And this is a program that really takes kids who are at risk of not completing the high school diploma to complete their high school diploma, and in addition to that, have and learn skills that are usable after they graduate from high school to retain a job. So I'm very proud of the work and the partnership that we have established with them and several other organizations to address the social determinants of health. Another major factor in your health is access to health care, and this is why the General has focused so much in the last several years to expand access and making it easier for people to stay close to home, stay close to their jobs, and be able to access health care. Earlier this week, we announced the opening of our new neighborhood hospital in Central Parish with its emergency room. And probably the most impactful thing that we did, particularly as a reaction to the crisis during COVID, was to open the emergency room and the acute care activity at the Mid-City Hospital. That hospital was primarily a post-acute care hub, and now has an active emergency room and acute care facility. And so back in March, as COVID worked its way through Baton Rouge, the biggest community need clearly was caring for patients who had the virus, and having Mid-City operational was a big, big help, not only for the General, but other hospitals in the area, and actually other hospitals in the state. Without those beds at Mid-City and the help that we received from the federal government and the Navy and others, it would have been extremely difficult for the other hospitals in the region to do the great work that they did in caring for these patients. So I want to thank Governor Edwards and Mayor Broom, Scott Wester and Eric and others who helped us make that a reality. And as COVID receded a little bit, just a reopening of that emergency room, we realized how important that asset was to the community in Mid-City and in North Baton Rouge. You know, there's been a lot reported on how people during and post-COVID are putting off emergency care and health screenings. And in fact, that has become, I believe, a public health crisis. While there have been about 200,000 plus deaths related to COVID, there have been more than 300,000 extra deaths that are non-COVID related over and above our traditional mortality rates. And I was wondering always, you know, what happened to all these heart attacks? What happened to all the cancers? What happened to all the strokes? The reality is people are scared of going to the emergency room, and the result has been unneeded suffering and deaths on the part of those who could have received that care in an emergency room, or the cancers that could have been found earlier if they had been going to their annual screenings. You know, over the next few years, we plan to continue to focus on access and the social determinants of health. We plan to continue to expand services at Mid-City, adding new specialties and clinics as the need arises. We're also working very hard to address the disparities in care that were so evident during the COVID crisis. It's been widely reported that African Americans are more likely to have serious complications from COVID, and we are working with our physicians and researchers to better understand the why and to take steps to remove barriers and address the issues that are contributing to the gaps we're all seeing. We'll be hosting a series of town hall meetings earlier next year to talk in more detail about health disparities. In closing, let me just thank again Mayor Broom and all the other partners who worked so hard to put our needs assessment together. I think working together, I truly believe that we have made a difference and that we will continue to make a difference in the health of the people that we all serve. Thank you.
Thank you, Edgardo. And next, I'd like to bring up Dr. John Kerwin with Pennington to share updates from Pennington Biomedical Research Center.
Thank you, Colette. So, Pennington, as you know, fits really well into this kind of initiative. in terms of healthy Baton Rouge. Pennington Biomedical has spent the last 3 decades researching the triggers of chronic disease and identifying how to lose weight, how to treat obesity, and how to treat diabetes. Our 4th decade, which we are about to enter, will be about putting that knowledge to work in our community. And we look forward to working with the mayor and with our partners in the health district to implement those goals. To begin, I have a few points to share with you that really blend well, I think, with this program, with the health district goals, and with what Pennington has been doing and will continue to do in the years ahead. So we've refocused our mission and expanded to include research related to patient care. And 2 of the initiatives that are propelling this new direction include our Model Diabetes Clinic and our Bariatric and Metabolic Institute. This diabetes clinic focuses primarily on Medicaid patients, and it's developing a novel weight management approach to stop prediabetes from becoming type 2 diabetes and putting type 2 diabetes into remission. We know this can be achieved if a person loses just 10% of their body weight, but the catch with that is that losing weight is hard, as we all know, and it can be very difficult in a primary care setting to provide all of the resources and time that's needed during a short visit. So we've developed a new business model that will put our scientifically proven cutting-edge treatments for diabetes prevention and remission into the hands of these physicians and their patients. Meanwhile, on the Bariatric Metabolic Institute side, we've combined expertise in research, surgery, and behavioral interventions under one roof to create advanced treatments for obesity and diabetes. We've assembled a world-class team of scientists, surgeons, physicians, nurses, and psychologists to help patients achieve their health goals. We've partnered with our health district colleagues at the Lake to establish and advance this program. We're using a variety of approaches in this instance to help improve health and make people feel better. We're providing them with tools and techniques they need to change their lives, and we're also doing surgical procedures that result in substantial weight loss, in excess of 70 to 80% of the excess weight that people are carrying. And as you might appreciate, that's nearly impossible to achieve on your own. And our research shows that these benefits are not just metabolic, they're economic as well. Adults who have severe obesity severe obesity have a reduced cost in terms of their medical care and their pharmacy costs by about 60% over the first 3 years after surgery. And these patients also enjoy better health, they have a higher quality of life, and they have greater productivity in their jobs. Another program that we started is called Healthy Beginnings. This blends well, I think, with Barbara's programs at Women's. Healthy Beginnings plans to enroll 400 Louisiana mothers-to-be, and the goal here is to provide them with an online weight management program. So we know what happens during pregnancy will influence the immediate and the long-term health of the mother and child. The effects of excess weight gain don't stop after the moms may have retained a few extra pounds after giving birth, or newborns may carry a little bit of extra fat. Gaining too little or too much weight in pregnancy increases the risk of heart disease and diabetes in the mother and in the child. And we know that children who are overweight or with obesity tend to become adults with overweight or obesity and have associated health issues. So we're addressing this issue way up front in terms of childhood obesity. Another program that I'd like to share with you is our Rolling Store. Not our Rolling Stone, but our Rolling Store. And our Rolling Store is a partnership with the Mayor's Office. And here we're using our nutrition research to make it easier for people to incorporate fruits and vegetables into their diets. Now, we all know the benefits of eating fruits and vegetables. They help people maintain a healthy weight, reduce the risk of heart disease, type 2 diabetes, and some cancers and high blood pressure. But for the most part, what people don't know or are not able to do is how to cook vegetables or use them easily in prepared and inexpensive dishes. So there's really a gap in perhaps our education system, in the way we're transmitting our knowledge of how to live, how to cook. And so this rolling store is providing a way to address that. And I'd like to thank the Huey and Angelina Wilson Foundation for helping with that. We've sent our nutritionists out and dietitians out into low-income neighborhoods to help, and our people are presenting tips on convenient ways to prepare foods and vegetables. I want to finish with a last vignette. It's a story about one of our very own researchers, Dr. Peter Kaczmarzyk. He and his team published a major finding in the world-famous New England Journal of Medicine just a few weeks ago. This is relevant and important for this Healthy Baton Rouge initiative. The study is entitled Promoting Successful Weight Loss in Primary Care in Louisiana. The acronym for that is PROPEL. This is a study about living in Louisiana. The team recruited over 800 volunteers from some of the poorest and most underserved communities here in the state, with the goal of losing 5% of body weight through innovative coaching and lifestyle intervention. The coaching, or the buddy approach that was used, was compared to usual care. The combination of this approach of coaching, dieting, and counseling resulted in patients losing significantly more weight than those who received usual care from their primary care clinic. Importantly, 2 years after the study, post-weight loss, these folks had kept off more weight than the comparative group, demonstrating A, it works, and B, it can be sustained. Importantly, these results show that successful weight loss can be achieved in primary care settings, in populations who have significant barriers to obtaining healthcare services. So those are just a few of the ways we and other members of Healthy Baton Rouge are helping our community to build better and healthier lifestyles. We are grateful to be part of the effort, and we look forward to a healthier Baton Rouge community. Thank you.
Thank you, Dr. Kerwin, and thank you to all of the CEOs who shared some of the accomplishments. There's a quote from Henry Ford that I'd like to share with you that it truly encompasses the spirit of what we do with Healthy BR and the Mayor's Healthy City in Baton Rouge. And it says, coming together is a beginning. Keeping together is progress, but working together is success. So I'd like to invite up Mayor Sharon Broom to talk about the success we will have with the 2021 Community Health Needs Assessment. Mayor Broom.
Once again, I want to thank you all for highlighting your experiences and the role that you have played in creating a healthier Baton Rouge. This is really an exciting day. As you can see through the guidance of the 2018 CHNA, we have had many successes, but we are not going to stop here. We will continue to build upon this foundation in the future. Over the last few months, representatives from Baton Rouge General Medical Center, Lane Regional Medical Center, Ochsner Health System, Our Lady of the Lake Regional Medical Center, Women's Hospital, Pennington Biomedical Research Center, and over 30 other organizations ranging from the health insurance industry to nonprofit agencies have identified the top 10 health needs in the parish for our next community health needs assessment. These include health equity and racial disparities, behavioral health, public health emergency preparedness, healthy living and lifestyles, chronic disease, maternal and infant health, violence prevention, social determinants of health, HIV and sexually transmitted infections, and pediatric and adolescent health. Our coalition is looking to identify the top 4 significant community health needs to be outlined for our 2021 CHNA. We are asking for community feedback from nonprofits and our residents to identify our top health needs. Participating in this assessment will shape our work for years to come. To submit feedback for the 2021 Community Health Needs Assessment, please visit healthybr.com/CHNA-2021. That's a mouthful. Let's try that again. healthybr/CHNA-2021. And if you just go to our Healthy VR website, you can find that information there. I would be remiss if I didn't take a moment to thank everyone here today, your organizations, and anyone who is engaged with my Healthy City initiative since 2017. We could not create a culture of health within East Baton Rouge Parish without you. Our residents deserve the opportunity to live their healthiest lives, and every day you help us work towards that goal. I would also like to thank our Healthy VR team that works within the mayor's office, Jared Heimowitz, Lauren Hebert, Mathilde Silverberg, Helen Frink, Alyssa Pepinto. I know I just messed up your name, Alyssa. Kalia Cox, and I also see Ellen, who is one of our fellows, working with us as well. Thank you all for all of your work that you do. You help our residents live their healthiest lives. Thank you so much. And if there are any questions between all of us here, we should be able to